Hi folks, my name is Tom Hartzell. I'm a trip leader for the Mountain Club, teach a few classes, and I'm also trained as a wilderness first responder. I wanted to let you know how I approach and assess a victim every time. It's pretty much by the numbers and I rarely deviate from it. It's also the way many wilderness first responders and many wilderness EMTs approach their victims. We all do it the same way. And I thought you'd appreciate knowing how we do it, what we do, and in what sequence. Note that this is not a course in wilderness first aid. If you haven't taken one, I highly recommend you sign up for one once enrollments can begin again. If you've completed a wilderness first aid course, this video will provide a framework for how you approach and assess a patient. It is used by wilderness EMTs and wilderness first responders worldwide. And while thorough, it is also very concise and efficient and actually saves you time. At a high level, this is the process we use to approach an incident in the wilderness where someone might need or request first aid. It starts out with 1, 2, 3, 4, 5, then goes to A, B, C, D, E, then goes to the head-to-toe exam, vital signs, and sample. The patient assessment finishes with your assessment, your plan for treatment, the treatment itself, and your monitoring in the field. 1, 2, 3, 4, and 5 are performed before you even approach the victim. 1 is always scene safety because there may be times where the scene isn't safe to approach. Things like rock falls and avalanches come to mind. For mechanism of injury, it's number 2, and you're asking yourself, just how did this person hurt themselves? A lot of times this may not be known, but in the case of a possible climbing accident or a mountain bike accident, it is apparent. Secondarily, what you're asking yourself is there a potential neck or spine injury that might have resulted from this accident? 3 is none on me, and this is where you put on your mask and gloves. Other first responders often refer to this step as BSI, which stands for Body Substance Isolation. 4 is, are there any more? Are you looking at just one victim, or are there possibly several where you have to perform some triage? And lastly, 5 is, are they dead or alive? This will help you assess priorities for who gets treatment first. If the scene is safe, you can approach the victim and call out to them. Introduce yourself if they're conscious and obtain their consent to provide wilderness first aid. If they're unresponsive or unconscious, their consent is implied and you can proceed with providing first aid. This initial assessment consists of A, B, C, D, and E and focuses solely on identifying things that are life-threatening. It is not the head-to-toe exam, but only takes a quick 8 to 10 seconds to see if there might be any life-threatening injuries. A, B, and C are all things you performed in wilderness first aid class. C is important because you're not only checking for a pulse, but also doing a sweep of the body to see if there are any life-threatening injuries that might manifest themselves. The one exception to doing A and B first is if you think a person has had a heart attack and they might benefit from doing C first instead. If someone looks like they've had a heart attack or someone tells you it appears this person has had a heart attack and they are unresponsive, you would check their carotid artery for a pulse. If they have no pulse, you would begin compressions immediately. D is deciding whether or not to control the victim's head if it appears they may have had a neck or spine injury according to the MOI you identified during the scene survey. You would control the head at this time or ask someone else to control it, or maybe even ask the victims not to move their head as you examine them. E is exposing and evaluating any life-threatening injuries or bleeding you find, and is something you would do if you detected those if you did them during the sweep performed at section C. You would actually lift the garments or possibly even cut them to be able to look directly at the victim's skin to determine just how bad the bleeding or the injury was. This would be done before you conduct the head-to-toe exam or proceed any further. If there was any life-threatening bleeding or trauma to the body, you would treat that before you proceed. Once you have conducted the initial assessment, which includes A, B, C, D, and E, you're ready to start the secondary assessment that you've all discussed and practiced in class. The secondary assessment includes the head-to-toe exam, taking the vital signs, and recording sample, which are usually done in that order. The sample might be conducted first, though, if you think the victim is losing consciousness. If I thought I was dealing with a medical issue and there weren't any injuries or trauma, I might also do a sample first in that case. But then I would go back and do the vital signs and my head-to-toe exam and document all of these findings. I would never skip any of these steps. There aren't any shortcuts. Once you have completed your assessment, you would document your findings, write your plan for treating the victim, provide the treatment, and then monitor the victim in accordance with your training.